First year as governor, he approved the funding for the Morsani College of Medicine, which is where we are today. So, Governor, welcome to the University of South Florida.
Thank you. Well, thank you. It's great to be here. I really appreciate everything that USF means to the state of Florida. We, are fortunate to be seeing numbers, key metrics decline in the state of Florida with respect to COVID-19. COVID-positive hospitalizations are down roughly 60% since the July peak. ICU COVID-positive down 52% since the July peak. The total number of people who are COVID-positive in Florida hospitals represents about 6% of all our licensed beds. And the number of hospital admissions we had statewide yesterday, which is usually a weekend, usually a big day for admissions, is the lowest since we've had in the middle of June. We have lower cases today, although, how much I think there's a lot of problem with these PCR tests, as we're seeing in some of the reports lately. Our antibody testing remains strong, and the capacity here, 27% of hospital beds are empty, 24% of ICU beds are empty. That's actually not, you actually want to have more than that just generally when you're running these things. That is a way higher percentage than if you would have done like March 1st in the state of Florida. There would have been much less capacity even before the pandemic really hit. And I think the most important metric, our ED visits for COVID-like illnesses, are down I think over 70% since the July 7th peak. So those are all good indicators. Obviously, we want to continue that. We're going to continue to focus on the main kind of pillars of what we've done. One, protect the vulnerable. That involves long-term care facilities and a lot of the things we did there, but also coming from the villages. It also involves supporting those types of communities where you have active senior populations. They remained active. But they remained active in a smart and safe way, and I think the results that they've had there, given the demographics, I think are very, very pleasantly surprising. Actually not surprising if you know them, but certainly better than I think what a lot of people thought would ended up happening. So that's a real key, given how COVID-19 operates under different age groups. We also want to continue supporting hospital capacity, healthcare workers. We have done tens of millions from the state, articles of PPE, face masks, face shields, gloves, gowns, you name it. It's been one of the biggest logistics operations in the state's history. We also stood up and supported with personnel. When you had certain hot spots in the state with a lot of hospital admissions, we would send folks down there, nurses, respiratory therapists, whatever was required, and I think that worked very well. We also have our COVID-only nursing facilities. There's 23 of those across the state. That's a safe way to isolate residents of long-term care facilities who have been infected and can't appropriately be isolated at their own facility. And we also made the decision, as we were seeing the prevalence increase dramatically, not just in Florida but across the Sun Belt at the end of June, to maintain hospitals doing elective procedures. The advice in March was to close those. So across the country, everyone closed elective procedures. Florida, we reopened at the beginning of May on that, and I think that doing it the way we did it this time was much better. So you have some hospitals had to draw back a little. Others didn't. If you look at like some of the big systems in Orlando, they didn't have to do it. Miami-Dade, some of those, they had to curtail it. But they were in the best situation to understand that. And healthcare is not limited to one respiratory virus. It includes all these other things that are very important. So that was really important. And we think we help support their operations by allowing the elective procedures to continue against the advice of people who are some of the folks who are considered experts. And finally, we wanted to keep society functioning. We've been able to do that. We've gained jobs in July. You have all kinds of things from our theme parks to beaches, restaurants, all that, hotels. Those have continued operating. Obviously, we need to put way more people back to work than what we've done, and we're going to continue to work on that. But part of, I think, keeping society functioning is having K through 12 schools as an option for in-person, which many parents have been really glad to have that option, but also our university systems. And USF I don't think there was really any question you guys were going to make it work. I think you've done, you've worked really hard at it. We were just talking with the folks at UF Health with what they're doing at the University of Florida, which I think has been very thoughtful. So having our universities up and operating is very, very important. We want to continue to support those efforts going forward. And of course, that involves the instruction, which is, of course, key. Also involves things like athletics, which we're glad you guys are going to be playing football, and we're glad that our other teams are going to be playing as well. So I appreciate the White House supporting a lot of our requests, whether it's medication, whether it was early PPE or testing. And, Dr. Atlas has been with us all day, and I think has been somebody who's been very, very strong on understanding that when you deal with a pandemic, you can't just turn a blind eye to everything else in society except one particular virus, that you obviously fight the virus, but the best way to do that is to have a strong society. And so he's identified the need to make sure other medical procedures are being done, to make sure schools function, and make sure people have more opportunities. So I want to thank him for being here, and I want to offer him the opportunity to come up and say a few things and answer a few questions.
Okay, thank you, Governor DeSantis. It's a great honor to be here, and I've been speaking with Governor DeSantis for quite a while about the pandemic, and he's really an example of doing something with the exact thoughtful approach that we need in this, because this is a policy issue. It's multifaceted. It's not just stopping COVID-19 at all costs, and President Trump's strategy is really is similar, very similar to this, which is 3 points, really. You've got to do your best to protect the vulnerable and the high-risk people. You have to make sure that the hospitals are still functioning and not overcrowded, because this so-called non-essential care is actually critical care, and I can go into that, but the lockdown is very harmful for other medical care. And, of course, point number 3 is safely open schools and open society, because it's really harmful to our children to have closed schools. Online learning is not the same. They miss all the educational aspects of socializing, sports, nutrition. Reported child abuse is not happening. All kinds of things that people really didn't consider. And, of course, that applies to the university system as well. And we have to get America back to work. And I think these are all doable. We know how to protect people. We've done a great job now in working on people who've been hospitalized. The lengths of stays are 1/3 what they were in April. Mortality's down 1/2 if you get hospitalized. Case fatality rate is 80% down in the United States. And a lot of things have been done by the Trump administration, including, of course, in partnership with Florida. I think it's a great example of how the federal government works very well with the state. The states are in charge of their policies. We help, we issue guidelines, and also massive resource allocation, particularly to Florida here, with things like PPE, testing. We are now going to have, in the next couple of weeks, every single certified nursing home in the U.S., 14,500, will have point-of-care testing. We're also making a big effort to get, we have this massive testing apparatus that the President, the Vice President, and Admiral Giroir and the task force have been directing. And we have this capability now of really getting point-of-care testing to people who are elderly and high risk, but not necessarily in nursing homes. So we'll have senior centers, their assisted living facilities have this sort of access. And, of course, we know the cases come in from the community into the nursing homes. So we really got to, we're doing much better with that. It's very challenging. The whole world has had a problem protecting the high risk. I think we're doing a great job, and Governor DeSantis has been doing a really terrific job, given particularly that Florida has second highest population in the U.S. of people over 65. So, all of this allocation of resources is now going to be used in a very smart way. And, we have a lot of reasons to be optimistic in the United States over how things are evolving. And again, like President Trump, Governor DeSantis is using the data and the science, and really fear is not part of the equation here. We actually have a good handle on what's going on. There's a lot of reasons for cautious optimism in the United States, and happy to talk or take any questions.